This is Dr. Myers. Allergy testing. So in dermatology, there is allergic contact dermatitis. Means that you're allergic to some product. It could be to nickel, it could be to neomycin, which is in Neosporin. It could be to rubbers or fragrances or a lot of different things. So in our clinic, we do the True Test, which is like 36 of the most common allergens. And how this works is we put these tests, for instance, on somebody's back, and we leave it there for a couple days, and then we take it off, and then we can see if a rash, it's a delayed hypersensitive rash, if this rash appears in these little squares or circles where we put this product prior. And if they're positive, you'll get a little bit of an itch, a little bit of a rash in these little circles or squares. If they're not, you have no change. It takes a few days to do an allergy test. So those that are immediate tests, those are more prick tests, and those are a little bit more common with allergists, and that's more for hay fever type of allergens, or for environmental allergens, airborne type allergens, rather than contact, something that comes in with the surface of the skin. So that's kind of the big difference. Some people who do more allergy testing and do more extensive testing, they have the North American series, which is like over 100 different substances. So they can do a much more extensive test. And these are less common reasons for you to get a rash. Most of the time if someone gets a rash, it's like eczema. And like a rare allergic contact dermatitis is we're usually falling back into this, or we're doing these tests because we just can't figure it out. Where this rash has been ongoing or comes and goes, over time for months or even years. It's typically not something you jump right to do a whole series of the North American or even the True Test from just a short-term rash. That's usually something that we can identify, or something that's not an allergic contact dermatitis. So it's a little bit confusing, but hopefully that clears it up a little bit and kind of gives you an idea of what allergy testing means.